So thank you everybody for coming. So Tony asked me to come in and do a session on evaluation, right? So how can we evaluate types of green space interventions that might either be structural types of interventions, or they might be projects and interventions that are actually out delivering in natural environments, working with people. How can we conduct rigorous evaluations that commissioners will hopefully take note of and look at? And it was actually a really challenging session for me to put together, because we've got a sort of variety of different roles and people in the audience. What I decided to do was to take you through some practical ways of evaluating green space interventions, which are just very basic and very simple. So if you're here, I hope you may be disappointed if you're here expecting me to sort of go through various randomised control trial methodologies. That's not what I wanted to do today. What I wanted to do was to use the experience we have working in Bradford just to outline some really simple and basic steps that a very small, for example, very small voluntary sector organisation might be able to implement in order to evaluate that project. And hopefully the principles will hold true for larger organisations as well. Just before we start, can I just get hands up if you are, I'm going to make you categorise yourselves here. If you're a researcher, can you put your hand up? Okay, just want to make sure that you're sort of sprinkled throughout. If you are more of a commissioner, the commissioner programme, put your hand up. Okay. If you are somebody, say, as a service provider, you actually work delivering these type of projects, can you put your hands up? Okay, excellent. Is there any type of person I haven't mentioned? Designer, brilliant. Okay. So I've got a fair amount of information to go through in the next hour, so I do apologise for that. I have sort of put in bits of time for us to have discussion as well. I've never delivered this type of session before, so we'll just see how it goes, I think. And if you actually just want to stop me whilst I'm talking and have a bit of a discussion about some of the issues, then that is absolutely fine. I should probably introduce myself before I go any further. So my name is Rosie McKechnie. So I'm the director of a research programme called Born in Bradford. As you might expect from the title, we're based over in Bradford. We're a big multidisciplinary research programme that looks at wide determinants of health and ill health, and looks at ways of making families and communities healthier places to be. And I brought with me, I'll let you guys introduce yourselves. So
I'm Anna Cornelius Chavez, and I'm working as a research fellow on Green Spaces project in Bradford.
I'm Hannah. I'm a PhD student at the University of Leeds. I'm from Bradford, so I'm a supervisor.
okay.
Looking at designing interventions to increase green space use.
Okay, so a big part of the research we do in Born in Bradford is looking at the impacts of green space on health and well-being, and we've published a fair amount of research in this area, collaborating with partners across the UK and internationally as well. One of the other major pieces of work we do is called our Born in Bradford Better Start, and essentially what this is within Bradford we have been successful gaining lottery funding from the big lottery for a £49 million investment into the city, which is focused on implementing preventive interventions for pregnant mums and children aged 0 to 3. And the idea is to intervene early in life to try and improve health outcomes for the future. As part of this pot of money, there is a distinct stream of funding which is about making safer places to play for children in some of the most deprived areas of the city. We have money for both capital-based improvements, so making actual improvements to green spaces and bits of disused land in the area, but also money for implementing more traditional services that might be out using green spaces as a setting. As part of that, I direct the Innovation Hub for the Better Start, which is all about bringing research into practice, and we work really closely in partnership with commissioning organisations and service providers to look at how we can build the best type of evidence base for the work that we're doing. And a lot of the work that we're doing within Bradford are relatively new interventions or projects that might not have a large evidence base behind them. And that's from that context that I'm wanting to talk to you today. So first, I just wanted to start to get you, so you don't fall asleep after your post-lunch dip. Have you all got, I asked for post-its and flip charts, and we don't have very many, but anyway, I think you've all got, if you can all find a bit of post-it or just scribble it down in a a bit of paper. I just wanted us to get start to think about what is impact. So what is it that we expect to be able to show from projects that are aiming to improve the health and well-being of communities? That might be green space changes, it might be going in and improving a park, or it might be delivering a walking group. So this is an example of our group that runs in Bradford. So it's a walk, talk and grow group. It's just a 30-minute walk for families with children under 5 years old, where they just go for a walk, they spend some time, they talk to each other, they have their children, and they provide refreshments at the end of the walk. Now, if you're thinking about what type of impact you want to see from that project, I just want you to list some of the possible impacts or outcomes we might see. For example, do you think that might have positive impacts on health? Do you think it might have positive impacts on engagement? It could be about capacity building, it could be about engaging volunteers, it could be about skills building of people running the project. So just write down some ideas of what you might expect the impact of that project to be. If you are one of the lucky few to have a post-it note, we're going to collect them and put them on the board there. So just okay, might just pick on some of you. Alex. Just because I know your name from the top.
Building great social networks.
Okay, great. Okay.
I wrote it down exactly the same. I put networking, so
Yeah.
the same thing.
Excellent. Okay. Jason.
You would want to be more likely to use green spaces in the future.
Yeah, great. Yeah. Julia.
I put improve support network through friendships games.
Okay. It's great. I've got good eyesight, so. Pip.
Greater use of parks or getting out and about a bit more,
Yeah.
feeling confident.
Yeah. Okay. Anyone else want to?
Improve family bonding.
Okay. You're looking at me, so.
Increase physical activity.
Increase physical activity. Excellent.
Sustained and independent participation.
Great.
I've got connectivity as well between families. That's
Excellent. Okay, is there anything else wildly different that anybody thought of as an impact?
And increasing their range of space that they might travel to, because that's often an issue, isn't it?
Yeah.
Going beyond their normal.
Yeah.
Yeah, sorry. No, decrease in crime in the park.
Yeah.
learning through the landscape, looking at leaf types, things like that.
Yeah. Okay. If you've written them on a post-it note, I'm going to get Hannah, do you mind going round and just grabbing them? That's great. So what you've all identified here is that from one project we can have many, many different types of outcomes and impacts. And what we want to do in terms of evaluation is make sure that we can demonstrate those outcomes and impacts. And what I wanted to talk to you today is about what is realistic and measurable impact in the context of relatively small scale projects. So I'm not talking of multi-million pound research trials here. I'm talking about what the, a local organisation, what type of evaluation they might be able to implement. So we have a range of different impacts and outcomes, and they might range at the very bottom of the ladder here from actually just being able to deliver a service or a project. So it could be that you work within a community where these types of services and projects there's nothing there to engage with particular types of communities. So actually one type of outcome or impact is actually just getting in there and delivering something which is fulfilling a need. Reaching target populations who are in need. And then as you move up to different types of impact, you start to look at things, well, actually you've got a service, but are people attending? Are you getting enough people through the doors to make that feasible? Are the people who are attending satisfied with what you're doing? And as you start moving up, it's only then that you can start to think about, right, what are some of the health outcomes that we might start to see as a result of these projects? And I definitely, all the outcomes and impacts that are about sort of social networking and social cohesion, I definitely see that as under and influencing the health and individuals' health, because that is social health as well as physical and mental health is a very important part of well-being. And then at the very top of this ladder, you start to think about your population health outcomes. So this is when you can start to think about, right, the cost effectiveness and what's the economic benefit of delivering these types of interventions. And as you move from the bottom to the top, you find the things at the bottom are relatively easier to evaluate, and as you move up, you find that they're much harder. And in terms of funding, you can implement very good, rigorous evaluations measuring these aspects quite cheaply, but as you want to go up to your population health outcomes and your return on investment, things get very, very expensive to do, and that's when you would typically need the help and input from academic partners, for example. So what I wanted to do today was just focus on the outcomes and impacts in that square, if that is okay. The work that I'm talking about today is based on work we've been doing within the Innovation Hub. So we've been working closely with Better Start Bradford, and what we've been doing is developing and designing a framework for implementing and evaluating early life interventions. And although our focus has been on early life, the lessons are transferable. So if anybody is interested in using this framework or finding out a little bit more about it, we are actively looking for people to come and use it as case studies to see how useful it is. And then you can contact my colleague Josie Dickerson, who'll be able to give you more information. So I'm just going to present quite a brief overview of it today. Okay, so getting the steps right of evaluation. The first thing that we need to do if we are delivering a service or a project is understand exactly what we are trying to achieve and have an understanding of how the intervention or project is going to work. So the first thing that we would want to do is to develop a logic model. Are you guys familiar with the terminology? Essentially, it's really simple. Essentially, all it is thinking about what you're going to do in the project, what impact you think that's going to have, and what ultimately will be the health outcome. You can't really see from the slide here, but I just put all these different pictures down of logic models in the background to show that they come in all shapes and sizes. And as far as I'm concerned, there's no right way or wrong way to do one. It's got to be logical and justifiable for your particular project. I thought it might be helpful just to have a look at a couple of logic models that I'm familiar with and that I've been working with. So the first one is one of the projects that I'm involved with over in Bradford, and this is about structural alterations to green space. So what we're aiming to do is to go in and look at areas of green space and change them to improve the quality of the green space and also to improve people's satisfaction with their local green spaces. So here, the inputs would be using a community co-design process to make changes to the local formal and informal green spaces, which would tackle some of the key barriers we know families find if they want to go out and use parks and green spaces. The output of this particular intervention would be that the changes would be implemented. We don't actually know what these changes are yet because we're just starting the co-design process, but for example, it could be refurbishing play areas, it could be providing new equipment, or it could be addressing issues of safety and security by installing CCTV, or it could be provision of walking routes. All the outputs would have the aim of improving the quality of the space. And what we then think that would lead to is our short-term outcomes, which is that the quality of the green space would improve, that people's satisfaction with green space would improve, and that would mean that more families visit parks. Now, as a result of these shorter-term outcomes, then what we would hope is that we would have an impact on longer-term outcomes. So if people are visiting parks more, then we hope that there would be physical activity levels would increase because we'd be encouraging to be physically active in the park. We would hope that their levels of stress would reduce because we know there is a link between being outside in the natural environment and reductions in stress. We'd hope that we would have improved social cohesion by people being out, talking to one another, and we'd hope that would have an impact on mental well-being. Essentially, what you have in your logic model is a guide to what you may need to make sure that you need to have in your evaluation plan. So for example, for this one, we need to make sure that when we're evaluating this, first off, we're evaluating how successful we were using our co-design process, how successful we were in implementing what the communities told us to implement, and then we need to make sure that we're assessing quality, satisfaction, and looking at how many people visit the parks, and then in the longer term, assessing these health outcomes. This is an example. There was a really nice report by the conservation volunteers which came out, which is looking at the example of green gyms. And this is just to give you an idea of a very different looking logic model, slightly more complicated. They've really gone into the detail of how they think their intervention is going to impact on beliefs and motivations. I believe you will all be getting the slides, and within the slides I've got links, embedded links for everything, so don't worry about taking too many notes. And it just means you can, if there's anything you're interested in, you can have a look at later. But the Green Gym model is basically about training volunteers in the community to act as leaders and to get people out into natural environments. And I think this is a really interesting logic model, because what you have here is not only the impact on the end user, who might be the people who you're trying to get out and being active, but you also have what the impacts on the volunteers themselves, so you have to think about those dual strands. So step one is to think about your logic model. You're really clear what exactly is it you're planning to do, what exactly is it that you're planning to see, and what do you think are the plausible links to your health outcomes. Any questions on logic models? Bob?
I'm new to some of this, so just an observation. On when you got to your long-term outcomes, you start to say that we hope this and this occurs. In a sense, aren't you prejudging, or shouldn't you put those things at the front and say these are hypotheses that this project is aiming to test, that if we do this, then this will happen? So it just that logic just seemed a bit back to front.
And actually you're right, you can shift it all round. So you could start with your outcomes and work backwards. The key thing is that what you're kind of asserting is a causal pathway in a sense. So yes, you're right, although my terminology is saying we hope to do this because
that's a kind of like, that's a hypothesis.
But from my perspective, there's a plausible justifiable link. Because I'm a researcher, I would never I always like to couch my language in as much ambiguity as possible. But yeah, the reason that is there, because there is that plausible link, and that's what we would expect to happen.
So with the short and the long term ones, I can see how easy it is to kind of quantify and therefore evaluate the short term ones. And
Yes.
Where we get to the longer terms, and that's where it starts to go.
Yes. And we'll come on to that later on. Yeah, but absolutely, the longer term ones are the harder ones to evaluate, and that is why I think if you're a sort of smaller organisation or it's a smaller scale project, it's really important to get these things right, because we know that the evidence shows that there is a link between your short term and your long term outcomes. It's about being realistic what you can actually demonstrate. Okay, so. You've got your logic model, you've implemented your project, you've changed your space, you've implemented your service. What you need to make sure that you're doing is really effective monitoring. So before you can go to anything else, for any kind of impact or outcomes, you need to make sure that you understand who's coming to your project and who's benefiting from it. What you need to do is that it's a periodic review of exactly what you're doing, the activities that you're implementing, and your outputs. And what this means is that you can essentially monitor yourself. So are you achieving your own targets? So if you've set up a walking group and you have made the case to the commissioners that you want to see 30 women a week or 30 families, are you actually achieving that? The other thing which might be really important to know is who's accessing your service or project. We know that there's wide health inequalities, and you can, unfortunately, with a number of projects, it's the people who are in most need may not access your service. And again, if you're trying to make the case to get a service or project recommissioned, it's really important to show are you actually reaching a group which other programs or projects don't reach. So the types of questions that you might want to answer with this stage of evaluation is: how many families is the project seeing? What are the demographics of the families participating in a project? And is a project reaching their target group? So it's really basic questions but actually really important to be able to demonstrate that. So in order to do this, it's about good record keeping. It's about having a really good minimum data set for everybody that you see through your project. So you need to think about what elements of the data set that you think are important. So for example, do you need name and address, or can you do without that? For most projects, you need to be able to uniquely identify somebody who's going through your programme, because this will help you later on find out what the change in that individual's behaviour has been. You might want to know date of birth, gender, disability, ethnicity. It may be appropriate for you to look at religion or sexual orientation. It may not. It's dependent on the project. So you need to think about what do you need to report back to your funders, and that will help you think about what minimum data set you need to hold. Now, there are issues with holding data on anybody, and those are things that everybody needs to think about. So first off, we need to make sure that we're getting consent from people who are participating or benefiting from a project, that they're happy that you're holding that information on them. You can either use an opt-in model of consent, where you're getting people to sign saying, yeah, it's absolutely fine for you to hold this information, or you can use opt-out, where you say to people, we'll hold this information unless you tell us not to. It's really important to give people not to restrict any type of participation based on that. So obviously any information that people give you is entirely voluntary, and they shouldn't have to answer any of those questions in order to benefit from the project. So it's worth being aware of that as well. Really importantly then, data security is a really important issue. So it's about making sure that you have policies and procedures in place to make sure that data is kept secure, and that you're adhering to acts such as the Data Protection Act as well. So if you get that all right, once you get the mechanics and the basics of a system, then you're quite well set up then just to routinely process information that's coming through for your project. So again, it's a really important step. It's not that exciting, but it's a really important step, and you'd actually be surprised how difficult it can be for people who are not used to working with data in that way and collecting it to collect things in this routine way. Okay, so on to something then slightly more interesting. So you know what your project's planning to do, you've got your logic model, you know who's coming to it, if anybody's coming at all. The next thing you should be interested in is thinking about actually how your project is being implemented. Is your project being implemented in the way that you're expecting? Because that is going to help you interpret what essentially is happening with your outcomes and your impacts later down the line. So we call this stage the implementation and fidelity stage. The aim is to look at, as I suggested, how your project's being implemented, whether your staff or the project is being implemented the way which you're expecting it to be, and also to look at how satisfied people are with the project or service that they're receiving. So your example questions here might be around how satisfied are users of the project, are there ways to improve project uptake, because it could be from your monitoring stage that you're finding there's actually certain population or demographics that are not coming through your project. If you can identify that early on, then you've got a chance to go and do a little bit more work to figure out why those people may or may not be coming. Is the project being delivered as expected? And are there ways to improve the project being delivered? So again, this is a good opportunity just to take stock of what's actually going on, just to see are there ways in which you can improve what you are delivering. So in order to do this, again, it is data, again, it's just about being disciplined about collecting lots of routine data about what's happening. So you would have a minimum data set here, which would be looking at, first off, how many people are using or benefiting from the service. And what's really important is at the outset that you set yourself some kind of target or understanding of how many people you expect to benefit. Most of the projects that we get funding for, we would have to make a case to the funder saying we expect X many people to go through our doors. So you need to make sure that you know that, so that when you're working out how many people are actually coming through, you can start thinking, am I working to the projections that I got the funding based on? You would want to, you might be interested in looking at where you refer, if it's a referral-based project, where your referrals are coming from, and how many of those are accepted. But also, really importantly, when people are declining, why they're declining. So recording that, so again, it's giving you a little bit of a clue about what's going on with that project that you might be able to change or improve. It might also be that you're interested in staff and volunteers, how many staff or volunteers you think you're going to need versus how many staff that you actually have. We work with lots of small projects, and even if just one member of staff goes on maternity leave, that can have a big impact on what's been able to be delivered. So it's just important to make sure that you're collecting all that contextual information. And also, your anticipated number of courses that you think you're going to run per year, and actually how many you manage to do. And you can do this periodically, so you can do it yearly, or you can do it every 6 months, or however useful you think you're going to find it. Satisfaction is also really important. So this is where you're actually talking to the people who are benefiting. It doesn't need to be hard to collect satisfaction data at all. So this is an example of just a really brief satisfaction sheet that we give out with a parenting programme that we run, and all it asks is we hand it out after every week. We just say, how was the session today on a 5-point scale, and then we ask them, what did you like, what didn't you like, any other comments. Now, it's really simple, but I was able to use all of these information sheets in a project and an evaluation report of I think it was about 200 parents in total, to then look at which sessions people liked and which they didn't like. And this is, so you could show a graph, for example, if you've got 6 weekly sessions, you can look at average satisfaction scores. And again, it's just a nice story that you can tell, that you can give to say, look, actually I'm delivering this service and people are really satisfied with it. On the other hand, you might find that there's something that people really aren't happy with, and that will give you the heads up to go and think, right, how do I change this? You can also, in terms of fidelity, I guess this becomes an issue when you're maybe running a larger project where you have staff out there who are delivering something on your behalf. And it really helps if you have good manuals and training packages to help facilitators or people delivering, so that they know what they're meant to be doing. But it's just a fact of life that people will deliver things in different ways and will do things differently. So it's really important to find out what's actually been going on in different sessions. So this is an example from the same project, which was a parenting programme, where we actually asked the facilitators who led the programme at the end of each week, did you actually do, you had a list of activities, did you actually do all these activities, and if not, what were some of the reasons? And again, that helped us to make changes to the project if we realised things weren't feasible. It's just as important for a programme to be acceptable to the person receiving it as to the person delivering it. And then finally, you could also, if you have a little bit more capacity, look at doing observations. So you could go out and look and just be a sort of unobtrusive bystander watching what's going on in sessions. And for this, you would need to be really clear about what it is you're looking for. So again, it's going back to the manual, what you're expecting to happen within the intervention, and just sort of ticking off that these things are happening in your project. These types of methods can also be supplemented by much more involved qualitative methods like interviews, focus groups and case studies, and these can be really useful ways of giving voices to the people who are coming through your project or programme. I don't have much time to go into those today, but we put together just a little bit of extra information, and my colleague Anna Chavez has put links to where you can find more information about these more in-depth types of methods in this document, so I've got a few copies here. Okay, is everyone with me so far? It's quite hot in this room, isn't it? So if anybody feels like they are going to pass out, we'll open a window. I'll keep an eye. Okay, so I think maybe just work on the tables that you're in, if that's okay. I just wanted your feedback really on then what you've heard so far. Thinking about your monitoring data, so that is who's coming through the project, things like ethnicity, demographics, your reach and attendance data, as in how many of your target population are you managing to reach and who's coming through the doors, and your participant satisfaction. I just wanted your thoughts and experience on what might be some of the practical barriers and issues to collecting that type of information. So I just give you 5 minutes, so I just looked at my watch. So just give you 5 minutes, and we'll just have a quick sort of chat. Is that all right? With a lot stronger food.
Labour intensive, all those situations together before you actually deliver whatever you're going to It could seem quite onerous, so we've got this idea of translate into these outcomes before we get to to satisfy,
I was interested from what I've talked about so far, what might be the barriers or obstacles to implementing. So, can I just start from this table? What do you think the type of information that we talked about, is that easy or difficult? Is it feasible for to expect organisations to collect it?
We touched on the issues of legalities, data protection, trying to sort of galvanise a team at the start who want to maybe reach some outcomes, and then it may seem onerous to have to try and bring all this work in, which obviously is essential work in, because it's part of the process, but it might not be necessarily about well, it is about what the outcome is, but it's part and parcel together. It's kind of onerous in itself.
I think that thing about owning the logic model, when you're, especially when it's a brand new project and you're employing people, you kind of got to hand that over, and people think, oh well, I'm new into this role and I just need to get the service delivered and not think about those things immediately.
Okay, this table, some of the problems or issues that you're discussing?
I think it was the challenge of the longer term outcomes of the project, and how you actually, in any meaningful way or affordable way, find a mechanism to actually pull those kind of ideas out. And we were talking about some of the things we could do in the short term in terms of, as well as the kind of quantitative in fact satisfaction and quality assessments of sites to look at the space, also do observations pre, during and after to look at how people are using the sites and numbers of people using the site in different ways.
So we'll pick up the longer term thing at the end. Just quick barrier or obstacle at this table?
Resourcing.
Resourcing, yeah. Okay, so we need to make this type of evaluation as easy as possible for people to implement. Here?
Kind of got stuck on talking about the difficulty of evaluating the width that green space can, in terms of the numbers of people passing through spaces and what that means for consent and what it means for ethics and things like that.
Ethics and consent is an important issue, Hannah, can you jot some of these down, because if I don't, then you can remind me if I haven't covered any by the end.
Whether it's appropriate, you're trying to make a sort of organic little group of people, in your case with the mums and the prams and all the rest of it, and then you start throwing these things at them at the wrong time. It can break the natural flow.
So
that ties into what he was saying about the making it part of it. It's very difficult to get that balance right.
It really is. So participant burden as well. So that is why you absolutely don't want to be going and chucking everything at these. We have to be sensible. And what I was saying to a group over here is it's about making sure that both commissioners and people who are delivering the project have a realistic understanding of what can be achieved in terms of evaluation. I think we've still got a bit of work to do. Right, I'm going to push on. Right, so after you've done your kind of bones analysis of what getting to grips with it, what exactly is happening in your project, then you are ready to then start looking at how you might be able to assess some of the shorter or longer term outcomes. And the simplest way that we would do this is just a really simple before and after study so you think about assessing, getting a baseline of where your service users are at before they enter your service, and then again repeating and finding out what their outcome is after. Didn't say that very well, but the key thing is that what you're wanting to do is to provide evidence of a change in outcomes. Now, you are never, unless you have thousands of study participants, going to be able to prove a definitive causal chain, but what you want to be showing to the people funding your project that there's enough of a trend, there's enough of a signal in there that you think your families or your participants are getting something out of that. In order to do that, there are just a few criteria. Is that you need to make sure that you're getting a decent amount of people going through your project who are giving you the information on this and this outcome. So you need to try and make sure that your sample of your evaluation sample is as representative as possible. So the rule of thumb that we work with within our work is that you would have data collected on at least 60% of your participants. One of the key issues here is about analysing the data, so there will be a bit of data analysis that needs to go on looking at the differences before and after, so that might be something you need to think about whether you need to get additional support with. The issues of data security are going to be extremely important here because you're potentially asking people to answer quite sensitive questions, and you need to make sure, and then that's where the role of ethics may come into question as well. So from our perspective, ethics approval is not required when you're doing a service evaluation. So when you are evaluating a service, the definition of research that we would work to would say that you don't need formal ethics approval for that, but what you do need to be really careful about is the types of questions you're asking families and making sure that you're not overly burdening families, and also that you're not asking really sensitive things that are going to invoke unanticipated reactions or within your families as well that you might not be prepared to deal with. In terms of thinking about your outcome, which you're interested in, it could be a range of things, but it really has to tie into what you actually think the point of your project is all about. So if we link back to that walking group right at the very start, well, if we think that's all about social cohesion, then our outcome would be something that's assessing maybe how much social support that individual feels that they have. If your project is about improving well-being, then you need a different outcome measure. The key thing is that you would want, in terms of making your case to the commissioners, you want this to be a validated and approved outcome measure. And essentially what that is an outcome measure where there's been some research showing that it actually measures what it says it's going to measure. So I've got a list of 8 questions that I think measure depression. Do they actually measure depression, or do they measure something else? I've listed a few examples of very commonly used outcome measures which would be appropriate for use in evaluating types of interventions that we've been talking about. And again, the links will be embedded in the slides. So if you're interested, you can find out more information. So this is a brief questionnaire that's about well-being. So this is a general population-based measure of well-being. Ask whether people have been feeling optimistic or feeling useful and relaxed. And again, this is used in population-based surveys, so it provides a useful kind of comparator. We also have, this is a really commonly used measure of depression, so this is the patient health questionnaire, 8-4, so there's 2 versions of this questionnaire. One has 9 questions and one has 8 questions. The one with 9 questions asks at the end, have you been feeling suicidal? That's just not appropriate for you to be asking families to complete that in the context of, maybe a walking group outside. So you need to be really careful about what you're asking people. And then we have other measures that might measure other health behaviours. So there's a measure of physical activity called the International Physical Activity Questionnaire. Measuring physical activity is just horrifically difficult. The only gold standard way of doing it is to go and stick a 200-pound accelerometer on a waist or a wrist and have someone walk around for a week. That's just not feasible. If you are interested in assessing physical activity, and this is probably one of the better self-report questionnaires that you can get. And again, on the links for all of these, you'll find a link to a website. All these measures are all freely available and accessible, and you'll find how to score them as well. So for most of these questionnaires, you'll come out with a score, and then what you'll do is you'll compare the score of the person before the programme with the score of the person after, and what you would hope is that on average you'd find people would be increasing. Okay, so far we've talked about just changes at an individual level, so individual people, but particularly on this table as well, we were also talking about actually different, looking at parks or looking at spaces and figuring out what's changed in those. So this is a slightly different set of tools that you can use to actually look at what's been going on within a space. So we can use audits and observations in the same ways we can use individual measures, questionnaire measures, to look at what's happened before and after you've made park changes or you've delivered things within a park. So your example research questions here might be looking at the quality of the space. So has the quality of the space improved? How many people are using the space? Oh, I've got that in twice. Or no, how are people using the space? It's really important if you are doing things that are looking at park use, you need to take into account just really simple, but things like seasonality. So you don't want to be, if you go in and do your baseline in winter, and then make some changes and then go back in summer and be like, oh wow, like, you know, it's massive, like increased 300%. Obviously we think probably weather's going to have a factor here, so you need to just make sure that you're giving that a bit of consideration when you're designing the evaluation. A couple of tools that we've used in our research in Bradford. So one is called the Neighbourhood Green Space tool. So this is a tool to give you a sort of quality score of your local green space. It can be used for parks or informal or formal spaces, and it basically just asks two observers to walk around the park at the same time, each independently scoring the park on a number of features such as levels of naturalness, incivilities, which is our favourite, Hannah, isn't it? Like whether there's like broken glass or vandalism.
45 parks using this.
Yeah, pretty well. Hannah's the expert on this if you want any further information. So again, that will give you a score, you know, so you'll be able to compare a score before you've changed something and after to see has that improved. There are a couple of observation schedules that look at then what people are actually doing in spaces. So these are called SO Play, System for Observing Play. So that is for younger children, looking at what they're doing. Are they being vigorously active or moderately active or being sedentary within a space? And also the SO Park, which is actually sort of more of a community-based observation that's looking at recreation within the park. So how are people using and interacting with spaces? And again, there's useful training guides for these that you can find on the web, and the link will be in the slide here. So if you feel like you want to listen to Tom McKenzie for 15 minutes telling you how to do that, he's got another 3. But they're useful tools, and again, it just a nice and different way of demonstrating the type of impact that you are having. So after you've been through these 4 steps, which is no mean feat, you know, it does take some resource and it does take a bit of expertise. It's only at that point that you would be ready to then look at your larger scale effectiveness evaluation. And so what we find is with a lot of projects that we work with, they're at the stage where they're not quite sure what the logic model is, they're not quite sure how the project works. So we work with them to first off get that all sorted out so that they're sort of really clear what they think is going to happen. And then we help them to work through these stages. And we don't, you know, realistically, you're talking a few years down the line before you have enough of an idea of what's going on to think about your big hitting effectiveness valuation and your cost effectiveness evaluation, and that's the reality. And I guess that was the key message that I wanted to get through, is that you know, they'd mentioned in our talks earlier that there's very, very few UK studies that ever get to the points 5 and 6 here, because it takes a long time and a lot of people to be able to demonstrate and show that effect. So we've got just got like a couple of minutes left. I guess what I was interested in, you can either discuss in your groups or we can just have 5 minutes where you just shout out, is what type of support do you think organisations need in order to do that more basic evaluation? Do you think people have the skills? If not, what types of things would be useful in order to help people do these types of evaluations?
Designated roles in evaluating.
Pardon?
Designated roles in evaluating sometimes. When people are on the ground delivering, what they are delivering, so if someone's going out doing a running session or walking session, that's what they're interested in, that's what they do.
Yeah.
And what they find is evaluation is very practical. It just gets them away for them, it breaks up the continuity of the session, the participants get a little frustrated with it, and actually it just almost needs a professional to come in and do that evaluation, I feel.
Yeah, okay.
It's also the independence factor of an external evaluation, because obviously when you're people delivering the project, you want it to work, and sometimes it's hard for them to be objective
Yes.
about some of the outcomes.
Absolutely.
There's also the logistics as well.
Mm.
Because
Yeah. So does it feel unobtainable? Like, does it feel that it's a step too far to get that independence? Or how? Because I guess from my perspective, it's like thinking, when commissioners are commissioning services, can we build into the project spec that element of evaluation to sort of try and get a bit of funding for it? Do you think that's realistic, or?
I think you end up spending more on the evaluators than you would on the deliverers in a lot of cases.
Mm-hmm. Well,
I think
sorry. And then you.
I was just going to say, no, as a very small organisation, we all have to do it. We're all out there and we're all evaluating, and we have to work together and to support each other. I think if we have something in place, and it's been really effective in having the support of my colleagues. It's like this is step by step.
Yeah.
So I mean, I think that's just for a smaller organisation, that's a reality.
Yeah. Yeah, I think that the steps I've outlined, sort of 1 to 4, don't necessarily need to be resource intensive once we understand what we need to be collecting and why, and have the systems in place, and that's hopefully where we can get to. So I think, sorry, I just wanted to.
I just think things may be slightly changing. I was just at Sporting the workshop. We got down to last few, and everyone had put an application. And then they said, look, you've all got to come back in. You've got to put more money. You've got to ask for more money for evaluation. They asked us to ask for more money for evaluation. They said, you're not accounting for how much it's going to cost. I think the perception is maybe we do need effective evaluation.
I think supporting that, I think you need the funder. I think it needs to be
it's the funder, it came from the funder. Yes,
no, but I think that evokes response, because if you know that your funder is dead keen on evaluation and committed to evaluation, then you're more likely to actively
supporting can probably afford to be not that many of us can.
Sorry, you have
I was just going to say that it might be worth asking universities and students for help, because I would be more than willing to help with any kind of evaluation, and I would do it for free. So
right, your email address is. I will circulate.
Something that can be really creative and expensive.
Yeah, but
that is an
for me,
issue, but
getting the experience is impossible.
Yeah.
I don't know who to talk to.
And in fact, Eric and I were talking about that just before the session, weren't we?
Yeah. No, I definitely feel that there's a really important role for universities here, and we can do it in so many different ways. We have undergraduate students who are looking for short-term projects. We have master's students who are looking for longer-term projects of about a year. We have PhD students. I wish I could say knocking on doors, we have to turn them away, but some of which could be, might not take a great deal of funding to make happen for over a 3-4 year term. Some of which might not require any funding. It just needs support and so forth. So I definitely think, and more than happy to, and I didn't mean to just perfect timing, I think.
I think time for 2 more comments. So here and then Bob, and then
just in response to that, the project I'm working on, we do have a few students that are helping with the evaluation, but the initiative is being delivered by, and the data is being collected by community health educators, which members of the public, members of that local community who are trained to deliver the initiative, and also trained in how to collect the data as part of the evaluation process.
That's a great model. Yeah. Okay, Bob.
I'm an operational manager in Bradford Parks, and I can't overstress enough the resource issue that's confronting people who are actually delivering the service. And I absolutely get this, and it's very important. I mean, we're not even measuring, we haven't even got metrics for what we're doing operationally and what we're delivering every day, because we just haven't got the resources to, and probably the skills in a lot of cases, to actually measure what we're doing and to monitor change over time. When we get a project that comes on, and we do lots of little projects all the time with friends or groups and with other funders, and having to measure that is just another overhead and a burden, and we just literally do not have at the front end the resources to be able to measure effectiveness. We do stuff because it makes common sense. It makes common sense to us to plant trees and surface paths and have flower beds, because that's what we do.
Yeah.
But
And
you
that's
know,
the
I'm going to
same
measure
story in
that.
Sheffield as well. And where we say the universities can help, and I'm sure they can, it'd be fantastic, but what I've found so far is that we're often on parallel kind of course, without the gap in the middle is just very big. So they've got their projects and their ideas, and we've got ours, and it's very difficult.
And we need to be working together a lot more. And so I think I've picked that up of in some of our other meetings that we're at together. But yeah, I guess what we're hoping for, we're not, you know, going to solve the problem, but what we hope with the model that we're working up is that we can provide a toolkit for, you know, to get you so far, to get you the basic,